Traumatic brain injury is one of the leading causes of disability and death in infants and children. Falls are the predominant cause of the injury for toddlers. School-age children experience a rise in traumatic brain injuries caused in bicycle injuries, and adolescents experience traumatic brain injuries caused by motor vehicle wrecks, sports injuries, and assaults. Trauma often results in a direct injury to the brain in the form of intracranial hemorrhages and contusions. Clinical symptoms due to these injuries are often related to the severity and the location of the injury. These are called primary brain injuries and are immediate consequences of the force of the trauma. Secondary brain injuries develop in the minutes to weeks after the primary injury. They occur in two forms. The first is related to numerous physiological and metabolic alterations, including hypoxemia and elevated intracranial pressure. This form of brain injury is potentially avoidable and is responsive to treatment. The other form of secondary brain injury includes numerous cellular events that occur in the minutes following the initial trauma and extend into the following weeks, leading to cell degeneration and ultimately cell death. Although research is ongoing for treatment of these types of secondary brain injury, there is no treatment available currently for this type of injury. Initial treatment of patients with a traumatic brain injury often focuses on detection of a primary injury and prevention or treatment of secondary brain injury. It is important that if one suspects that a child has suffered a traumatic brain injury, that appropriate medical evaluation and treatment be offered and is obtainable through a referral from a treating pediatrician who has been provided a complete history of the injury and the symptoms.